Good. So we're going to jump right into discussion, and I'd like to start by getting really practical here. We have a number of people who are joining us on this webinar who work for local and national NGOs on the ground in countries including the DRC, Nigeria, Jordan, and South Sudan. So I think it would be really great to hear from our presenters how they've been seeing these tools used not only at the international headquarters level, but also at country level. And we had a question submitted ahead of the webinar from a Lebanese organization. So the question that we have here is a practical question about how effective these tools can be used under the pressure of time, under pressures from donors, and under the general pressure of just trying to respond to those in need. So we're going to go to Joe Puri first. Joe, just asking you a very practical question here. Can you give us some examples of gap maps being used by decision makers? Over to you, Joe.
So like I said, gap maps are a really good tool to see where impact evaluations are there or are not there, or where there are impact evaluations but very little synthesis of evidence. And where we've seen this really, so really they're a very good way to influence decisions around where should we collect more evidence, or what should we do in terms of evidence synthesis, either one of those two questions. And so this has been done. I can give you several examples. In a most recent gap map where we looked at agricultural risk insurance, this was used by a pretty big donor to then understand as to whether evidence should be, there should be more evidence that is provided for agricultural risk insurance uptake, because one of the things that we found through our gap map was that it wasn't the more longer term impact and outcomes that were not being informed. It was just the short term outcomes, such as uptake, that were not being informed by the evidence that we were getting. And so an entire program of evidence has now built around that. Very similarly, we've done now work around environmental conservation, for example. And there we know that there are some areas where there is pretty good evidence, but essentially, other than protected areas, there's very, very little idea of where, of what the evidence is saying, and also primary evidence. So really the advocacy is around generating primary evidence in a whole lot of other areas, and then synthesizing evidence around these. And these are, again, all of these are big actors who are funding research, and so that's how gap maps are helping to influence decision making. So in agricultural risk insurance, in conservation and environment, and my last example is actually around sanitation and open defecation, where again some work that we did in the scoping part of an entire evidence program showed us that there was very little evidence informing us as to why people aren't using latrines, for example. And that's where an entire evidence program is now being formulated. Thanks.
Great, thank you so much, Joe. Really good concrete examples there of how these gap maps are being used. Moving to Ellie, wanted to know from you, Ellie, and welcome, because we haven't heard you speak yet. So welcome to the webinar. And can you give us an example of how organizations like Oxfam at both headquarters and at country level might be able to use the findings from your systematic review? So for example, how should WASH or protection programming change if it's paying attention to this research?
Great. Thank you, Alice. I think this is one of the most critical questions. And when I think about how we might formulate recommendations, I think there are 4 areas depending on the findings of the individual reviews. Those are, first of all, to adopt new practices or policies. Secondly, to continue existing ones. Thirdly, to stop practices. And in a lot of other fields, we have seen this is where systematic reviews often have strong findings, but it's a very difficult process to implement. And then lastly, as Joe has already talked about, and many others, areas for investing in further research where we have gaps. In the reality, from our preliminary findings from our reviews, the results are generally more nuanced and kind of across those 4 recommendations. So if I look at kind of the 2 areas, you mentioned their WASH and protection programming, and it's great to see so much interest in trying to have more evidence around protection programming. The WASH review team screened over 13,500 citations and synthesized 47 studies in 51 contexts that met their inclusion criteria. They have many very kind of nitty-gritty practical recommendations that are helpful for hopefully Oxfam's WASH teams and partners on the ground. And those include, for example, around household water treatments, that there's relatively higher use of liquid chlorine than chlorine tablets. But the reasons for that is, if you look at the impact evaluations themselves, is perhaps that the liquid chlorine interventions included programs that promoted, distributed, marketed, and redeemed vouchers for chlorine solutions. And some communities had previous experience using vouchers or in development programs, whereas the chlorine tablets themselves were often predominantly distributed through non-food item or NFI kits. So perhaps we should look at how we're implementing programs. And indeed, the team there has had broader recommendations, first of all, for responders interested in implementing outbreak programs to use simple interventions with clear, consistent messaging through several communication methods, and secondly, to engage in open communication with the communities to dispel fears and address local concerns for disease outbreaks and WASH programming. And they've also recommended that policymakers consider the importance of fast, flexible funding and the value of pre-positioned hygiene kits and the importance of kind of development interventions and contributing to the acute response. Secondly, if I go to the child protection for unaccompanied and separated children, to that systematic review, the evidence there has looked very different. So that team screened over 5,500 studies and had only 11 studies meet their inclusion criteria. And if we look at their domain of kind of interim care, this corroborated findings from studies in non-humanitarian settings that children demonstrate better social, emotional, and behavioral outcomes in family-like care situations, such as foster care, than they do in most residential settings. But again, it's nuanced, and they see that foster care needs to be well supported and monitored to achieve these positive outcomes, and that residential care can achieve positive outcomes if appropriately standards, if they have appropriate standards such as staff-to-child ratios are in place, and the emphasis is put on the quality of the caregiving relationship with the child. But then secondly here, the review team again had strong findings on the limitations of what we can say for practitioners from the systematic review based upon what has been evaluated. So some very kind of niche programs were evaluated, whereas some of the approaches that are often taken currently, such as case management, didn't have any evaluations that met the inclusion criteria for this review. So it's a strong call for kind of further research in this area.
Great. Thank you so much, Ellie, for some really detailed and concrete examples of how people can use these systematic review findings to inform planning and programming. And for more information, they can check out the website for the Humanitarian Evidence Program, where you'll be publishing the findings from those reviews as they come in. So it's really fantastic. Moving to the IRC, I know Cherie and Christophe, you've already talked a bit concretely about the steps that you're taking to roll this out, but if you could expand a bit more on the kind of support that you can provide to humanitarians both within the IRC but also outside the IRC who are interested in using your tool, that would be terrific. And I just want to add on to that practical question a couple of the questions that we're getting online for you that hopefully you can help clarify. So one question is, how do you define clients? So how are you defining that term client? Second question around, how do you contextualize these theories of change for each context? So you've shown us your general outcomes matrix and these sub-outcomes. How are you contextualizing those theories of change for different response contexts, or perhaps this person means different country contexts even? And then finally, how are you accounting for and reflecting on the assumptions made about particular theories of change? So kind of a bundle of questions there. It's quite a bunch, but hopefully you can help clarify your approach to theory of change with respect to these assumptions being made, these contexts, and then just a basic clarification on terminology. What do you mean by client?
Okay, great, thanks. I'll get started. So on the original questions that's up on the screen right now, just to reiterate that it was important, I think, to make the evidence useful for practitioners to have it part of our broader programming framework. So the entire effort to define the outcomes, develop the theories of change, and embed them in this, and embed the evidence in this broader framework was really critical. To make this available across the organization was quite the effort. So apart from first general introductions through webinars for our staff that work in 40 different countries, we then organized regional workshops in 5 of our major regions with country program representatives. And so over 3 days, we walked them through the logic. We explored in depth up to 3 specific outcomes and the theories of change and the indicators that go with this. And we walked them for a whole day through different use cases, practical examples drawn from actual projects and proposals or donors' calls for proposals, to how to use the tools in program design and project design. So based on that now, our technical teams are the main expert on the tools and on the available evidence in their area of expertise. And so they're now following up on specific use cases, but also on in-country trainings that the country teams are conducting for those staff who were not able to participate in these broader workshops. How can we make this now available for the broader humanitarian community? Obviously, the interactive OEF is our main vehicle for that, and the impetus behind that was both to make it more easily accessible for practitioners within the IRC, but we definitely wanted to engage the broader humanitarian community and make this all available and make it part of the dialogue on outcomes-driven and evidence-based programming that is going on in the wider humanitarian community. We do have that feedback email. So right now there is no, for the electronic or the interactive tool, there is no direct, say, chat or help desk link within the tool available, but we do encourage people to send us specific questions, to send us specific feedback, and we're happy to engage, of course, on specific issues related to the theories of change and to the evidence presented in the IOEF. On the additional questions from the chat, I'll get started and I'll let Shiri chime in, or I'll let Shiri generally chime in. So how do we define client? Client simply is all the people we work with. We did not, or it's a shift from the term beneficiary, which we saw as too passive, and so the term client we use synonymous with how we used beneficiary in the past. I hope that clarifies that. Contextualizing TOCs is definitely a big concern, in particular for our in-country teams, and has been a big part of our rollout effort. We have another in-house initiative that works on stronger contextualization and analytical tools for contextualization. So we're working closely with them on combining some of those tools. That is not represented right now in anything like the IOEF. This is more of an internal effort. But yeah, we do realize, and we're happy to share some of the insights from them as well if people want to follow up specifically on that. I think I'll let Shiri take the questions about the assumptions on the TOCs.
Yeah. So, yeah, great question. I think addressing the assumptions in two ways. So one is just always making sure that we can clarify what they are, and this is the work of the technical teams, and part of the discussions when we roll out each of these TOCs in our country programs. You know, the previous question about contextualizing TOCs also is very relevant for the assumptions as well, right? So if it's just about a sort of technical causal assumption, that sits with our technical teams, and we're charging them to be very clear about those. But a lot of the assumptions also require thinking about how change actually happens in a given context. You know, what sort of mechanisms matter, and so on. And so we envision that this is a starting place, that the IOEF and the sort of general TOCs are a starting place for engaging in that conversation, but most of those discussions and decisions will have to be proactively made by technical teams in each country for each given program.
Great, thank you so much, Christoph and Shri. And really good point there about contextualization and the participatory nature that's needed, or approach that's needed in order to engage with those issues. I'd like to shift gears a little bit and talk a little bit more about methods, and then go back to a few more questions that are coming in online. So Roxanne at Feinstein, you've talked about what it means to do an evidence synthesis and systematic review, and you've also discussed, as I mentioned, quite honestly, the difficulties that your teams faced in using this method. You talked about issues in particular about the quality of data that was available, or the quality of research and studies that were available. So we'd like to ask you, what are two things that humanitarian researchers can do to ensure that their work will be useful and used in an evidence synthesis?
I could go on about this forever, so I will have to restrain myself to just two. The first, and I'm very sympathetic to this as I'm a researcher myself, is I think we can all do a better job of talking about our methods in the reports that we publish. So in numerous cases, we found really fascinating studies that we would love to include in our work, but the study itself doesn't mention, for example, how many participants they recruited, how they found the participants. Was it a survey? Was it ethnographic work? Where did it take place? In which regions? Over which period of time? Really, really, really doable things that we already do when we're conducting research, but which somehow sometimes don't find their way into the reports that we publish. And this goes for journal articles, but also for institutional reports that our organizations put out there. So this could be as simple as a methods appendix, or even a couple of methods paragraphs that describe how the research was conducted. When we have that information, it's a lot easier for us to synthesize evidence, to appraise evidence, but also to know which types of studies are comparable and which types are not. When that information hasn't been available, our program has tried really hard to get it. So we've contacted authors to ask these questions, even when their published material doesn't contain the answers to it. But again, without the methodological information, it's very hard for us to include these fascinating studies in our evidence synthesis. The second point is sex and age disaggregation, and not just sex and age, but generally disaggregation of whom do these findings apply to. Humanitarian crises, be they a flood or sexual violence, do not affect all people in the same way. So when a study says people found or people said, it makes it very hard for us to disaggregate. Are these children? Are these men, women, boys, girls? Are they disabled? What are the factors of identity or of structural factors that might affect how these people experience crises and experience humanitarian assistance? So to the extent that we can design our studies with this disaggregation element in them and then report on it, I think it makes the evidence we collect stronger. I think it makes our findings stronger. And I think it's also critical that we understand that people experience crises differently. And so when we write up their experiences of them, we can't flatten that difference.
Great, thanks so much, Roxanne. Two really concrete and I think fairly easily practiced things that researchers can put immediately into their work to improve the usability of their research for these types of reviews. Just moving to Joe, wanting to ask you, Joe, a bit more, if you could go into some more detail on how you've adapted your approach to gap mapping for the humanitarian sector. And also if you could touch on this humanitarian development divide, or now it's being talked about as the humanitarian development nexus. 3IE has primarily focused on gap mapping in the development sector. You're doing a bit now in the humanitarian sector. So we're just wondering, what does gap mapping offer us in terms of looking at the evidence around this nexus? Are there different bodies of evidence relevant to the development and the humanitarian sectors? Is there an overlap of relevant evidence between those two fields that can be better exploited? Over to you, Joe.
Thanks very much, Alice. So a couple of things. You know, even the maps that I showed in my presentation, they were done actually quite before our current incarnation of evidence gap maps. Our current incarnation of gap maps, admittedly, look much more spiffy now, in the sense that we now have a process and we show them online, and you can link each one of those studies. But the maps that I showed to you, actually, we're working to update those because they were done in 2014. But there were two important things that occurred to me when I was getting ready for this webinar. The one thing is that one of the things that 3I has been doing are also using these as a platform to understand evidence need. If you look at any of the evidence gap maps that are out there, whether the ones that IRC and Oxfam are producing, or any of the ones that 3I has produced, basically what you realize is there are huge gaps. This in itself doesn't indicate where you should be funding or supporting research. Clearly, there are always going to be many more gaps than filled spaces, just because that's just the law of math. So we also use these evidence gap maps as, and I think I alluded to this in my presentation as well, as a form of consultation. And most recently, we've started to use these to then understand as to what tuple of intervention and outcome is most important in terms of evidence need that is required by an implementing agency or an organization on the ground. So they don't clearly, they're much more interested in some types of evidence, but not other types of evidence. So one is evidence needs map. The second part of your question really referred to the development humanitarian nexus, and you're absolutely right. We started to, come into the space to think about it around 2013, mainly because that's where we saw a huge need. And like I said in my presentation as well, there's not a lot of good, high-quality evidence out there, even though, yes, a lot of this work is being done. We're supporting an evidence program in this area, as is IRC and Oxfam. But there's not a whole lot of good evidence out there. Does that mean that you need to discount those standards of evidence? I don't think so. I think some of the points that were made by the other presenters remain salient. The important part is, but in this context, one of the evidence gap maps that we've also produced is one on peace building. So this is an evidence gap map that you can actually go to our website and find, and it is in the in the new spiffy incarnation, so to speak. And there we found that there were 100 impact evaluations and 6 systematic reviews. And arguably, peace building is at the nexus of development and humanitarian work, although if you were to listen to the dialogue of the most recently concluded World Humanitarian Summit, there's no such thing as just development. Everything is humanitarian today. So anyway, I'm just going to stop there.
Great. Thank you so much, Joe. And always love using the term spiffy to refer to evidence tools. So we're close to time here. I'm just going to ask a final question to everyone and ask people to keep their responses to just 1 minute. It's kind of a bigger existential question, I suppose, which is drawing on what many of you have mentioned in your presentations about the gaps in original source data or source evidence, pieces of research on the ground about these different issues that all of your tools have been addressing. When you look at systematic reviews or gap maps or the OEF, there are a number of outcome areas or intervention areas across all of these where there can be insufficient evidence to draw a conclusion about effectiveness or the best program design. And this seems to be a real challenge to trying to bring a step change improvement in how humanitarians use evidence for planning. So how can people use these advanced tools for better decision making when there still seem to be huge gaps in the quality of data? And should we just go back to basics in the humanitarian sector and focus our efforts on better data collection? So first we'll go back to you, Joe, final answer on that, and then we'll move to Roxanne and Ellie, and then IRC.
Thanks, Alice. I think two things. The first is think about other creative methods of doing high-quality impact evaluations. I think one of the key things that's coming out in the world today is the use of big data, satellite data, etc. And I haven't seen a lot of that being used, not just in humanitarian assistance, but really across the field. And that's a huge omission, especially because really big data, satellite data, geospatial data can be used in really creative ways to deal with some of the confounding factors, some of the indigeneity problems that impact evaluations really help to deal with, but end up using fairly restrictive methods to then understand causality. So if you are using these sorts of data sets somewhat more creatively, you can deal with a lot of the problems that traditional impact evaluations have dealt with in fairly limited ways by using fairly limited methods and data. The second is, I think my big takeaway is engage, engage, engage. You have to start engaging with the stakeholders who are going to be using this information, this data, this research right from the beginning.
Roxanne, what are your thoughts on this issue of whether or not we should go back to basics?
Sure. To be honest, I'm not sure what back to basics means, but I'll tell you what I think it would mean to me, which is that all of the organizations on this webinar produce a lot of data and produce a lot of humanitarian research. And I think one way in which we could really help this line of work is to make that research available and accessible to other organizations. So very frequently, when we put out a call for studies that we can include in our evidence syntheses, we're running into a series of barriers, people not wanting to share particular studies or evaluations, or people not wanting to share evaluations when that evaluation shows that a particular intervention didn't work, or wanting to share this data internally within a particular organization but not being comfortable sharing it externally for inclusion in a public evidence synthesis. And so I think for all of us, a commitment to making our existing research and the evidence that we're generating more accessible to other organizations that can use it to inform their own work, to inform their evidence synthesis, or to inform their own prospective research would be refreshing, and I think would be a way of going back to basics that would really aid the sector.
Fantastic. Thanks so much. And Ellie, do you have any additional thoughts to add on that?
Yes, that's great. I'll just add upon that from Roxanne. There's 2 points that I mainly want to talk about. And first of all, the question is, you said there are a lot of gaps. And that's true, and we have found that as well. But sometimes I wonder, why are there gaps? Is it that we need a different type of evidence? So for the Humanitarian Evidence Programme, we've generally encouraged our review teams to go broad. And if I think about Oxfam's work and our theories of change, a lot of what we try to do is around campaigning and evaluations of campaigns where there's an N that equals 1 look very different than other types of evaluations. So I think it's first of all examining why are there gaps, what terminology are we using, do we have a different type of evidence that we can use? We do a lot of qualitative synthesis, for example, in our systematic reviews. And then secondly, I would say, yes, we need to encourage the basics, but we also really do need to examine the evidence that we have. What is the alternative? We do need to build upon our existing evidence. As Roxanne was saying, there are many evaluations, different types of evidence out there. We need to be willing to examine our assumptions, be better than the medieval doctors with their leeches, and really put affected populations at the center by using the existing evidence that we do have.
Great, thanks so much, Ellie. Love moving away from doctors with their leeches. IRC, a final short thought on the importance of building back the kind of baseline evidence base for these bigger tools.
Yeah, I think we agree. So back to basics, collecting good data, having strong M&E, I think is indispensable. So for all efforts, and it should not be an either or for sure. I agree with our colleagues that certainly sharing, having an open dialogue, sharing existing evidence much more among organizations and among peer organizations is very useful. Filling the gaps, using evidence or gap maps systematically to fill gaps, coordinate on that between within the humanitarian sector would be very important. And then have a dialogue about what are good evidence standards beyond systematic reviews and beyond of what is the established canon, I think would be very useful.
Terrific. Thank you so much. And it just leaves me to thank all of our fantastic, outstanding presenters. We've really only been able to scrape the surface here, and that's why it's so important that we have these follow-up pieces for everyone to bear in mind. So please send feedback to the OEF, on the OEF to the IRC by July 29th. The Humanitarian Evidence Program will be releasing the reviews over the next 6 months at the website you see on the screen there. And then you can find that interactive evidence gap map that Joe was talking about at the link there. We will be providing a recording and a transcript for this webinar over the next week or so, as well as some additional materials, background on these 3 initiatives. So please keep an eye on the ALNAP webpage for that, as well as keeping an eye out for our next webinar in this series in September. Please give us your feedback, and we'd always love to hear ideas that you have for this webinar series. Look forward to hearing you, and thank you so much to all of the participants.